As the race against COVID-19 heats up, countries like Sierra Leone are lagging far behind in terms of vaccination. 7 months since it commenced its vaccination exercise, only about 3% of Sierra Leone's population has been fully vaccinated, according to official data. Besides hesitancy, which has been due to misconceptions fueled by fake news, occasional shortages of the jabs has also contributed to the low uptake. But authorities say not only is there enough jabs now, hesitancy has also reduced. The National COVID-19 Emergency Response Center says it is revising its approach to focus on providing access by reaching out to the people with the jabs rather than waiting for them at designated centers.
When you bring the vaccination close to the people, for instance, myself and some colleagues were in Bo very recently, and we realized that when the vaccination team visited the market areas, a lot of market women or people around those settings actually we are going in their numbers to get the vaccines. But when you tell them to go to designated points, then they find it difficult in some ways to go to those areas.
With this new approach, the center is targeting special interest groups like transport unions, the teachers' union, and religious leaders. A pilot of this approach has already seen long queues at mobile vaccination centers, particularly places of worship. Harold Thomas, risk communication lead at NACOVAC, says people are more inclined to take the vaccine when their leaders take it. This, he notes, was demonstrated with the enlistment of the religious leaders.
We are dealing with some mosques in the Lompa area that is around Waterloo, and when the leader, the chief imam for a cluster of mosques, actually took the vaccines, every Friday since then, the list we have is like 500 people every Friday in those areas. So as they are taking more and more mosques, are also requesting for the teams to actually go to their different mosques for us to provide the services. So this means that the problem now is not hesitancy, but it's like access. If we provide access, a good number of them will go on their own free will.
Data from NACOVAC indicates that only a little over 400,000 people have received at least one dose of a COVID-19 vaccine. Of this, only about 140,000 have had the full dose. NACOVAC officials say this gap in the number of people who have taken the first and second doses emphasizes the urgent need for the access approach.
Still get challenges in the fact that you get some people who don't get the first dose, they not come for the second dose, maybe because of various reasons, and also because from time to time you can get stockout of some vaccines. So now it's only now that we just don't get AstraZeneca vaccines. A lot of people will take AstraZeneca vaccine as the first dose, and they not be available for some time. So now we try to prioritize ensuring that people receive their second dose, so that when you get your second dose, you are fully vaccinated.
In the early days of Sierra Leone's vaccination program, a lot of people rushed to take their first dose when a policy requiring proof of vaccination to access government buildings was imposed. Officials admit that they focused too much on the first dose. Stockout of vaccines, particularly AstraZeneca, also contributed to the situation. The NACOVAC says it is expecting more vaccines and it intends to expand the program by then. When Sierra Leone started its vaccination campaign, it had only two types of vaccines, AstraZeneca and Sinopharm. There are now two more types, Johnson & Johnson and Pfizer. Unlike the others, the Johnson & Johnson vaccine requires just one dose for full immunity, and officials hope that this will help in increasing the number of fully vaccinated people in the country. In May, the World Health Assembly set up a goal to vaccinate 10% of every country's population by September 30. Only 15 African countries met that target. Sierra Leone is one of the 37 countries that failed to meet the target. Some 4.8 million people 18 years and above of Sierra Leone's approximately 8 million population are eligible for the vaccine. The goal is to vaccinate 20% of these by the end of 2021. Some countries have done so well with their population above 18 years that they are reducing the age limit to 12. But NACOVAX says its focus remains on the 18 years and above bracket. Healthcare workers have performed the best, with 65% having received at least one dose, according to NACOVAX data. The country is doing poorest with the age group 60 years and above. NACOVAX recently issued a public statement urging people who have family members within that age bracket to bring them forward for vaccination. It even made available an emergency toll-free line, 117, for families to request for home service. A policy requiring people to provide proof of vaccination to access entertainment centers hosting large groups of people at a time is also in force. Even though NACOVAX officials say hesitancy is no longer a serious problem, it obviously remains an issue, despite massive public education over the months. And the concerns include the effect of vaccine on fertility, pregnancy, and people with comorbidities. These are all common concerns across the world, even in developed world.
This injection, people they be afraid. Me myself I be afraid. I say because they say you get sick. But I don't take nothing not happen to me. So I encourage me come people man they say may they take this injection. The card is so important.
The United States Centers for Disease Control and Prevention recommends for vaccination of pregnant women. In its advisory updated in August, it says, COVID-19 vaccination is recommended for all people 12 years and older, including people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. Evidence about the safety and effectiveness of COVID-19 vaccination during pregnancy has been growing. These data suggest that the benefits of receiving COVID-19 vaccine outweigh any known potential risks of vaccination during pregnancy. There is currently no evidence that any vaccines, including COVID-19 vaccines, cause fertility problems in women or men. Pregnant and recently pregnant people are more likely to get severely ill with COVID-19 compared with non-pregnant people. While the WHO doesn't call on member countries to vaccinate pregnant women, it doesn't rule it out either. The policy of NACOVAX appears to align with that of the Global Health Agency. But as Dr. Tom Cisse, the vaccine lead at NACOVAX, explains, it has nothing to do with safety issues.
The COVID vaccines are all safe for pregnant women and lactating mothers. In other words, Cobra. The vaccines are safe for all of them. So as at the last time we get a technical discussion, we may just say, okay, let us leave the pregnant women out for the time being, for the simple reason that pregnancy is a very delicate process, and miscarriages are common. They can happen anywhere. You understand? And we don't want situations where somebody will get miscarriage and attribute them to the vaccine. You understand? But except in a situation where, the level of COVID transmission very high in a particular area, then we advise the pregnant woman for letting take the COVID vaccine.
Rumors of expired vaccines and reports of episodes of side effects from the vaccines have also fueled these fears. The public concerns reached crescendo in July when a woman died shortly after taking a COVID-19 vaccine. But Dr. Cisse says all reported reactions to the vaccines have either been the usual episodes of fever or headache, or coincidental health issues resulting from infections from other diseases like malaria.
Vaccination has not meant that other sickness that they don't. No, you can get typhoid, you can get malaria, you can get hypertension, diabetes, and all of that. You understand? But we get incidents where people can get some other condition, but because they don't take the vaccine, then they will give a call, say, okay, they are having this symptom because of the vaccination, which is usually not the case. Over 550,000 doses of vaccines, COVID vaccines, have been administered in Sierra Leone to Sierra Leoneans. That is more than 10% of the population of this country. So I think that in itself now a level of assurance about the safety of the COVID vaccine. All what we will encourage people is that if you are taking a 2-dose vaccine, please ensure that go back at the date when they give you for you take your 2nd dose, because not only then you will get full protection against COVID infection.